Can you see and hear me out there? Quick sound and video check, as always, just to get things rolling on this fine afternoon. So we got folks tuning in from Texas, all over the place. Usually get folks all over the country, east, west, Jacksonville, Florida. Today we're talking about the NPTE and the essential things you need to know for the exam on exam day. So most of you guys who are here today are targeting the July NPTE, which is coming up, I think, faster than anyone wants to admit. But we're here to help you. PT Final Exam, I've been doing this for about 7 years now, helping people get through the exam. And I think you're going to like what we'll talk about today. I'm going to give you some real actionable tips to help jumpstart your studying and talk about some of the free resources and some of the resources I have over at PT Final Exam to help you get through the exam day. Let's see, you got folks tuning in from Louisiana, Chicago, California, Texas, Washington, all over the place. So thank you so much for joining with us. I know you guys are busy, you got lots of stuff going on, so I'm going to try to make this as action-packed as possible as a webinar can be, and get through lots of content that'll help you as you prepare for exam day. So our goals today, we're going to be talking about what is actually on the NPTE. We'll talk about the exam blueprint, what material is actually tested. We'll talk about any of the main changes that came about for 2018 and 2019. We'll also talk about main categories to study, how to study effectively, and we'll talk about practice questions. We'll make sure to get through. I even have a couple of practice questions for you, as well as some practice question tips. All right, so first thing to know, for 2019, there were no major changes. Rather, the last major change was in 2018, where they did some changes to the lymphatic system, cardiovascular and pulmonary system. Essentially, they altered and switched around some of the categories just a little bit. And I'll show you this in table format here in just a moment. But essentially, they created and separated off the lymphatic system. So you need to make sure to be spending time on the lymphatic system because you can plan on somewhere between 3 and 8 questions on that section. Gastrointestinal system examination, they added a few. In fact, I should just say a couple of questions. There can be anywhere from 0 to 2 questions on GI examination. They reduced the number of MSK, or not multiple choice, the musculoskeletal system questions by about 10%. And then they did some other minor reallocations. The PTA, really, they followed the same category. I know there's always a few people here who are listening to this as they prepare for the PTA exam. And then the PETs are available as of the start of 2018, and those are the same all the way now through 2019. So I don't think they're planning on changing the PETs. They don't announce this, but when I've talked to them about it before, they're not planning on changing the PET exams again until 2020, maybe late 2020. Anyway, so here is all that information in table format. So I like to point out that on the exam, you can plan on the big 3 systems: cardiovascular, musculoskeletal, and neuromuscular. These are the ones that have the highest or heaviest representation on the exam. And obviously, these need to be where you're spending most of your time. So if you look at the number of questions per system, obviously that musculoskeletal system and neuromuscular are by far the most heavily represented. And the way that should translate into your studies is spending most of your time on those topics and concepts rather than spending all of your time on one of these other smaller systems. Now, don't get me wrong, it's still important to know and see those smaller systems. However, you just have to spend most of your time on the musculoskeletal and neuromuscular systems. All right, then we come down here to the non-systems. I get a lot of people asking me questions about how to study for the non-systems. The good news is I have a whole non-system section as a part of all of my courses where you can get in and see all of the different potential testable items here in the equipment, devices, technologies, modalities, safety and protection, professional responsibilities, and research. I try to break that all down to make it really easy and digestible as you prepare for exam day. And that's included in all the stuff that I have at PT Final Exam. So be sure to check that out. And just as a note, there's really only about 5 or 6 questions in each of these subsections. So we're talking, somewhere around 25 to 30 questions total on the non-systems. Again, that's only half as many as are on the musculoskeletal system. So point is, this should be where most of your study effort is put into the musculoskeletal, neuromuscular, and the cardiovascular. The big 3 is what they call those, but especially musculo and neuro. So just study proportionally. Make sure you're spending enough time in those big sections so that don't spend so much time in the little sections at the expense of the big section, is what I'm trying to say. All right, so to learn more about the test itself. So when they create the test, now I've been to the FSBPT headquarters on 2 separate occasions. As you know, the FSBPT is the administrator and creator of the NPTE. They have an educators workshop every year. I've been to that twice. And in there, they talk a lot about how the questions are taken from current textbooks, how they use current textbooks to craft and create the options in all of their questions. It doesn't come from review books. It doesn't come from journal articles. Rather, it comes from core textbooks. And so you can find what they call the textbook survey here. If you search for FSBPT textbook survey, you'll get a list of all the most common textbooks that are tested on the NPTE. And so it'll include the big ones like Physical Rehabilitation by O'Sullivan, McGee, Dutton, Kisner, Goodman, all of those great PT textbooks. You'll see that the textbook data, textbook survey includes all of those. You can also find the content outline. So this is what we talked about here. This is the content outline. Although it goes into a little bit more detail. It's about 18 pages long, talking about each subsection. It has a lot of generality to it, trying to broadly tell you what is on the exam. But I do recommend you at least spend a little bit of time looking at the content outline. And again, you can look for that by just searching for NPTE Content Outline 2018. And 2018, that was the most recent update of the content outline. And the next update will be in 2023. So plan on using that content outline from 2018 for the time being. And then as far as what they actually test, they use what's called the practice analysis. Again, this is getting off into the weeds a little bit. But just so you know, the way they determine what is on the test is based on what the field of physical therapy is practicing at the current moment. So therefore, they use this practice analysis to ensure that they are testing what is actually being used out in the real world. Lest you think that it's just a couple of guys in suits out at the FSBPT headquarters trying to come up with hard questions for you. Rather, it's your peers, other physical therapists, who are determining what the practice is like, and they are actually the test volunteers, and I'll talk about that here in just a moment. But the questions are being written by your peers rather than just a bunch of suits in Washington, D.C. And so this was interesting. In 2018, they did increase the standard, so the test is a little bit harder than it was a year and a half ago. So plan on answering all of the questions correctly, but you do need about 4 more correct in order to pass in 2019 than you did in 2017. Same for PTA, you just have to answer a few more questions correctly. And this is partially because our field, because physical therapy is gathering more and more responsibility as we become direct access practitioners, as we broaden our scope of practice, that they do expect us to do better and better, as you would expect. All right, so what is actually on the NPT? That's what we've talked about with the content outline. Now remember, the NPT is not going to be a complicated, balancing of chemical equations or complicated mathematical formulas. No, rather it's going to be stuff that you know. It's not going to be surgery, rocket science, brain surgery, any of that. What's actually on the NPT is what you find on the content outline. It's what you have studied and what you've learned, just applied across the spectrum in what they like to call this the entry-level practice spectrum, or where a physical therapist could potentially be treating someone in the first year out of school. They want to test that broad knowledge, the conditions, the patients, the scenarios that you would likely potentially see across the nation in the first year of practice. And so that's what the content outline does. It tries to point out the number of questions in each section so you can study proportionally and understand what the scope of the exam is. And then the other thing is they do use textbooks, currently published textbooks, as their primary reference. So I always tell people, if there is a topic or some content that maybe you're less familiar with, be sure to spend time in the textbooks looking at it, because that's where the test questions come from. The review books are awesome. I do have a review book that's original and included as a part of any of my courses that you guys potentially enroll. I know there's a couple people who are already in some of my courses, but I do include a review book that is totally original. But any review book is really just a brief review of content that you probably already know and you just need your memory jogged. But if there is material that you haven't thought about in a long time, or you need to really remediate, that's where you need to go back into those textbooks, like Physical Therapy or Physical Rehabilitation by O'Sullivan, McGee, Dutton, Kisner, Goodman, all those great PT textbooks. All right, so how do they develop the exam? So I'm going to tell you just a little bit about how the questions on the exam are developed, just so you have an idea of where these questions are coming from. So the test is actually written by your peers, by a diverse set of item writers that are across the practice spectrum as well as across the country, meaning that there could be someone from Florida writing a couple of questions, Texas, New York, out west, Midwest, any of these areas, or they get these volunteer item writers, which are physical therapists that are licensed and practicing, to come in and help create the first draft of practice question, or not practice, of real questions. They're trying to create that first draft. And then it goes through about 8 different committees as it is edited and improved for clarity, to make sure that it is just right for you to really test the knowledge that they're after. And then each item is actually put out onto a live test, is what they call the pre-test item. So on any exam, there are 200, so we're talking PT now, there are 200 scored items and 50 pre-test items. So these pre-test items are indistinguishable from the others. They are not identified, and they are randomized throughout the entire test. So they're not in a 50-question block at the end or anything like that. They're totally randomized. And these items are rolled out in this live environment to see if they are valid items before they're rolled out into the actual exam. So 200 items are actually scored. Then they use these 50 pre-test items to determine their validity before they're rolled out and given to you live to see if you'll get your license. And just so you know, they use, I've talked with a few people who are in the psychometric. This is such an interesting field. So interesting that I'm not planning on doing anything in it anytime soon. But psychometric qualities involves understanding the predictive nature of exams to see if it's actually testing what you want it to test. And so they have a bunch of boards. I mean, there's a big board in Nebraska that helps determine the credibility of exams. And so the FSBPT has to go through a big process to get this item response theory, or basically all the psychometric qualities in place so that the test is actually valid and testing what it's planning on testing. Anyway, that's probably more than you ever wanted to know about the actual development of the test. But sometimes there's this myth that there are just a couple of committees back in Washington, D.C. just creating questions full time. And that's not the case. It's your peers coming up with these questions. So think about it like that. Now, this is what an actual physical therapist wrote, saw, and that you need to answer in order to pass the exam. All right, so we talked about this. There are 200 questions on each exam that are actually scored. This is what's called a block or an exam form. So on any test day, you can plan on, there's about 5 or 10 different exam forms out there. This just means that they're trying to prevent cheating as much as possible by having, if you were taking the test exactly next to a friend of yours who's taking the test, that you'd be taking entirely a different block of questions entirely. It just means you can't cheat. And so there's bunches and bunches of questions out there. And because there are different forms of the exam, that's why they have to score it in such an interesting way. They have to use what's called a scale score. I talked about this a little bit last week. I know there were some of you that were there at our Analyzing Your Performance Feedback Report lecture, but we were talking about exam scoring because there are so many different forms of the exam. To make each exam equivalent to the next form, they have to use the scale score. And the scale score is really zoomed in right around that 600 mark, meaning that they're most interested to see if you have crossed that 600 mark to pass the exam, or if you're under that 600 mark to fail the exam. Now, this is not grading on the curve, and I think I've got this as a myth a little bit later. This is not the curve. So if you guys remember, to grade on a curve means that they take the bell curve of responses, and here's your 50%. What they do is they set the passing mark here where 75% of people pass and 25% of people fail. So this is what grading on a curve means, that you're just passing a certain percentage. This is not what the NPTE is. Rather, the NPTE has this set standard, 600 out of 800, which is really it's really close to the 130s, 140 mark out of 200 correct. So that's the raw score. So again, really what that means is somewhere between 65 to 70% is about where that passing mark is. So if you can target above 70%, and I tell people to plan on 75%, if you can plan on getting 75% on your practice exams or above. Obviously, the more the better. That's a really good indicator that you're in good shape, ready for exam day. And then remember, there's no penalty for guessing either. The way they score it, just they take all the right answers, they subtract all the wrong answers, and that's your score. There's no penalty. It's not adaptive. It's just a set block of questions. It doesn't get harder if you get a question wrong. It doesn't get easier. That's all right. It's not adaptive. It's not nothing goofy. It's just a straight set of questions. Answer them all right. All right. So I skipped these slides here for a moment, but let's see. What do I want to say? Oh, so each test item, so each question is only used 1 or 2 times before it's retired forever. So that just means that if you take the exam, let's say that you took the exam in April and failed in April, if you took it in July, not only would you likely have a different form, but likely that form you took has already been retired, so you'll never see it again. So just don't plan on seeing any of those questions again. All right, on the exam, there are 5 sections on the exam. So we're talking PT exam. PTA exam has 4 sections, but for the PT exam, there are 5 sections, 50 questions in each section. Now remember, I told you some of those pre-test items are randomized. There are actually 10 in each of these 5 sections, 10 out of the 50, making a total of 50 pre-test items out of 5 sections. So you are allowed to take what's called the scheduled break after section 2. And a lot of you already know this, but point is that plan on using that scheduled break. They give you 15 minutes where the clock stops. Clock stops, you can go out, get the bathroom, get a drink of water, get a little snack out of your locker, whatever. You can go and take that little break and come back in, and it hasn't been deducted from your time. However, you can take what's called an unscheduled break between any of the other sections. And what I mean by an unscheduled break is where the clock does not stop. So this is if you are desperately needing to go to the bathroom. You can jump up, check out of you have to finish the section. They don't let you walk out mid-section. You have to submit the section. You can take a break between that section, but it better be quick because your time is ticking away on any of those unscheduled breaks. When you're on the test, you have the option of striking through any of the answer options. So this is just for your convenience. It doesn't have any bearing on your score, but if you do want to strike through any of the options, you can strike through it just so you can more easily navigate the test. But again, they don't care. It doesn't have any bearing on your score. Strike through to your heart's desire. Same thing with marking any of the questions. You can mark questions for further review, but again, that's just for your benefit to help you understand or to help you navigate questions that you wish you had a little more time on and want to see versus questions that you've already completed and moved on. Now, my big advice here with marking the questions is to mark the questions only very sparingly. Because what happens is that you spend, let's say you're going through the test and you come to a question that has some, it's very difficult for you or you don't know the answer. So you stare at it for about a minute. You're looking at it, you're like, I just don't know the answer to this. And so you put down an option, always mark an answer, no matter what, always mark an answer. You put down the answer and you move on, but you mark that question for further review. So you finish that section, and in your mind, you told yourself you need to go back to that question and review it again. So you do. You come back, except this time you've got to review what you've already seen in the question. So it takes about another minute to look through that item and really start deciding whether, what option is correct. And so you only have an average of 72 seconds per item to complete the test, and that just means you better be moving along at a steady pace. You only have just over a minute for each question. But if you mark a question, you've already spent time on it, and you're telling yourself you have to spend more time on it. So what that does, it takes away time from other questions that you maybe have a better chance of answering correctly. So only mark the item if you really think another few seconds is going to help you or you really want that second look. If not, if it's just a guess, if it's a total guess, just put down an answer and move on. Because, looking at it for another minute is probably not going to change anything. Just be judicious. Like I had a student, this was a couple years ago, who I think she marked every single item on the test, meaning out of the 250 items, she marked like 249 of them. What that did is she had to spend half time first time and go back and spend another half time on each one of them. She said it was exhausting. She felt like she had taken the test twice in the same day. So, word to the wise, mark as you only mark sparingly. Just mark what you need and no more. On the test, they also give you a scratch pad. Scratch pad, this is a dry erase pad where you can mark down any items or create any special annotations or calculations that you want to do. A lot of people use this for what they call brain dumping, where once you get into the test room, because remember, you can't take anything in with you, but once you get into the test room, they jot down a few acronyms, a few range of motions, a few things that they want to make sure to remember throughout the test, and they're worried they'll forget them due to the anxiety. So you can use that scratch pad as a brain dump in order to jot down a few things. Now, you can't take it out with you. You can't take anything in with you. It's just what comes in with you on your brain. And so the irony is that as you practice what you'll put on your brain dump, that you won't actually need it because you've practiced it and it's locked in your brain. So kind of an interesting psychological trick to helping your test performance is to prepare what you'll put on that brain dump or on that scratch pad, which will then improve your performance because you've studied that material so well that you don't actually need it. But so you see what I'm saying? It's a little bit of a psychological trick for yourself. Let's see, we already talked about scoring. We talked about the main categories. Remember those big three: musculo, neuro, and cardio. All right, let's talk about some of these myths. Now, I've already talked about a few of these, but just want to make sure I hit all of these. False. The test is harder in July and easier in January. That is absolutely not true. The reason people say this is because more people take it in July, more people graduate in the spring, April, May, and so therefore there are more people taking it in July and fewer people taking it in January, and they're thinking that it's on this curve where they're going to pass 75% of the people. So therefore, because there are more people, there would be more people in this failed category. That is not the case at all. That's a myth. The test is the test, same scoring system. And honestly, more people pass in July because there are simply more people taking it. More people fail because there are more people taking it. So it's the same result is occurring, the same score is occurring. There just happen to be there's a bigger scale of people heading through there. But the test is not any harder, and the scale of the scoring is not any different in July as it is in January. So take it when you wish, and it's all the same. Another myth is that 800 out of 800 means a perfect score. This is not true. 800 out of 800 means you got about 92%. 92% just means that they don't care anymore. You got an A on the test. They're like, yeah, we really only care about people just around that 600 mark. So 800 out of 800 means about a 92% correct. So lest you think anyone out there who's got 800 out of 800 is like the end-all be-all, they got about a 92%. And maybe a little bit more. But truth is, they did really good, which is great. But it's certainly not. The scale scoring is, again, zoomed in at that 600 mark. So there are multiple correct answers to each question. I get this every quarter. Someone comes through and they're like, Will, I feel like there were just more than one right, and there was more than one right answer to each of the items. That's not true. Each item has only one most correct answer. And in the class that I run, I talk about some of the tricks that sometimes show up on the test. So for instance, one of the and we'll call it tricks. One of the tricks that shows up is that they'll ask you a question, they'll ask you what you would do next. And one of the options will be to continue your examination. One of the options will be to perform an intervention. One of the options will be differential diagnosis or something. But the point is they're trying to see if you will skip steps. Even though that's a correct intervention for the diagnosis, you're not done with your examination. So therefore, you would be skipping steps to jump straight to an intervention. So almost always in cases where you feel like there are more than one correct answer, the most correct answer is the one that you would do next, or is the most clearly associated with an outcome with that diagnosis. So point is, there's not really there is only one actual correct answer to each item. And if you go into the test with that mindset that there is only one correct answer and you need to find it, then that helps rather than the mindset of, there's multiple correct answers. How do you choose between one or the other? They're all the same. That's not the case. Just pick the one that is the most correct. The most direct, the safest, the most applicable, the most effective. Look for that one most thing. I think I talked about this one already, that the FSBPT is out of touch with reality. Again, this is the assumption that it's just people in the home offices of FSBPT putting together the test. That is not the case. It's actually your peers putting together the test, and then just some editing committees to make sure that it's very clear what the question is asking. So again, it's all based on recent data, recent textbooks, recent practice analysis, all very recent. And then the last one, the test is purely academic. This is a myth. It is applied academics. So you have to know the content in the textbook. Absolutely required. So for instance, I keep my big pile of textbooks over here. So in Dutton's orthopedic examination, evaluation, and intervention, obviously there's a lot of academic stuff in here. There's a lot of description of the diagnosis, the injuries, the mechanism of injury, all of that. They'll take that information and they'll frame it in a case. They'll say that, a patient comes in, just had a recent, we don't want to say they had a pivot twist injury while playing football. Which condition is most likely present? And so what they're doing is they're taking that clinical case and asking you to apply your knowledge of the mechanism of injury for ACL tears into that clinical case. So yes, you absolutely have to know the academic knowledge, but then you have to be able to apply it. And that's, again, one thing we talk about in the class that I do is how to apply all of that great academic knowledge into, true clinical knowledge as well, which is what you need as a physical therapist anyway, is to have good working clinical knowledge. All right, so here's a little review. This is content review and practice review to help you with your studies. So in physical therapy, if you look at Shumway-Cook, when you talk about motor control, there are a couple of different ways to practice an activity. So for instance, you can do what's called massed practice. That's where you do everything all at once. Practice time is greater than rest time. You can also have something called distributed practice, or where your rest time is equal to or greater than the practice time. So this just means that you train an item, you give some rest and some time before you test the item or you look at the item again. So you've got this pulsed application of the content where you look at the content, take a little break, come back to that content, and you actually get better generalized learning in situations where you have distributed variable practice. And so that's in here to this next line where we talk about constant practice, where you practice the same thing over and over and over again, versus variable practice, where you actually create a variable environment where you practice one thing, then the next thing, and come back to that first thing again. So variable practice actually improves your learning in novel situations. So the reason this makes any sense, especially in the perspective of studying for the NPTE, is that on the exam, they randomize all the questions. Like they don't have all the musculoskeletal questions first, they don't have neuro next and cardio next. It's all randomized throughout. So therefore, your generalized understanding and learning must mimic, you must be able to pull out of your brain all of that different content in a variable situation. And so what my suggestion is, as far as studying goes, and I talk about this in the class too, and I even have a calendar that I help people kind of create this schedule. The idea is that on day 1, you study material 1, but then on day 2 and 3, you study material 2 and material 3, meaning that on day 1, maybe you study knee conditions, musculoskeletal knee conditions. Day 2, you study strokes or cerebrovascular accidents. And day 3, you study heart attacks or coronary artery disease. And then on day 4, you spend some time back on number 1 again. And the other way, and this, I've got a little calendar that helps you with this too, but also on day 2, you spend 10 minutes, just a really brief amount of time, rehashing what you learned on day 1. And same thing here. So you have this big study day, followed by a big study day of something else with a light review of what you studied the day before. Because unfortunately what happens, I see this all the time, that someone says, okay, week 1, I'm going to study musculoskeletal. And they get into that musculoskeletal, they work like crazy on musculoskeletal, and they say, okay, week 2, oh boy, this is my cardiovascular and pulmonary conditions. I'm going to study all that on week 2. And then week 3, by the time they get to week 3, they're into the neuro. And week 4, what happens is they get then into the non-systems. And then by the time they get to week 5, you can see where I'm going with this. By the time you get to week 5, I got my forward. By the time we get to week 5 and you study musculoskeletal again, you have forgotten everything you learned, or maybe not everything, but you've forgotten a lot of what you learned from week 1 to week 5. There was so much time in between that you could forget. So rather, my suggestion to you is to spend a little bit of time the day after you study something doing some light review, and then study something else that day and do the same thing, and then come back for a more thorough review after a few days and continue this on for the weeks to the test. And this is how I structure my class, is I try to hit all of the broad concepts from examination to differential diagnosis, prognosis to intervention in that order, rather than musculoskeletal, neuro, and cardio in that order, because we tend to forget everything by the time we come back to it again. So that's the idea with practice. And remember, this applies to physical therapy as well. So if you're trying to do some gait training on a patient, remember, just doing massed practice is not as effective as doing distributed practice, where you spend time on a task, then you move to a different task, and then come back to that task. You'll actually get better generalized learning in those situations because you varied the practice. All right, so we talked about that distributed and random practice, meaning that you're spending time on a variety of topics each week, not just one, main topic. And this is the same thing in PT school. You'll have a cardio class, a neuro class, and a musculo class all at the same time. And it's just the way to get information to stick. You get better generalized learning, better retention. And this is also based on some studies about studying, which is an interesting topic if you ever want to get into talking about what's the best way to actually master content. It's this distributed practice method. And there's some Harvard studies that really back this up. And then the other big thing, and everyone already knows this, but practice testing in a test environment is one of the top ways to get information to stick. And the reason is that it's a variety of practice questions in a test environment. So a low stakes test environment helps you understand the content, learn that content, and then apply it the next time you take a practice test. So remember, always take a test in a test-taking environment. So this is just to improve your test stamina, to be able to hold up to 5 hours of practice testing. Another big thing I like to talk about is make sure that you're doing high-density, high-yield studying. This just means you've turned off the distractions. You're not spending all your time on Facebook and telling yourself that you're actually studying. I mean, how many times has this happened to you, where you get in there, you start studying, and you're distracted by something else, and before you know it, 2 hours have passed, and you've done very little. I think that in 2 hours of good study time, you can do as much as what some people do in 12 hours of study time, just because it's so hard to stay so focused for 12 hours at a time. And then be sure when you study to study with a goal, meaning that you're going to master a concept. When you sit down, you're going to become the world master in that topic. And if you sit down with that in mind, that dramatically improves your study habit, your study technique, rather than just sitting down to look at a few words on the page. Like I've had people, they've emailed me like word for word, no kidding, someone emailed this to me. They said, "Hey Will, I read Physical Rehabilitation by O'Sullivan from cover to cover. I read the whole thing, page 1 until page 10,000 or whatever it is, 1,500. I read the whole thing, page 1 to page 1,500, and I still didn't pass the test. What's wrong?" The truth is that just reading words on a page is the least effective way to get information to stick in your head. Most effective ways to do this distributed practice, like what we talked about, where you're studying topics with the idea or the goal of mastering that content, and then taking practice tests to determine. Not only does it give you a prediction of what your score will be, but it also gives you an opportunity to test your knowledge without looking at the answer first. So when you commit like that, it makes a big difference to your studies. And then this is another big one. So this is my test zombie here. Don't just bury yourself in a cave. When you hate doing something, you tend to do everything you can to avoid it. So try not to hate studying. And what I mean by that is sit down with a goal. Set 2 or 4 hours, whatever it is. The average is 2 to 4 hours. Set that time aside where you're going to study, and that's your goal. You're going to study like crazy, be the master of a concept by the end of that study period, and then reward yourself at the end of that study period with some exercise, walk, quality time with friends, whatever. Just don't become a test zombie where you hate studying. And that's because that's what happens to the people who study 12 or 14 hours a day. Is that they lock themselves in the basement bedroom, they don't have any windows, and they say, "I'm going to study for 12 hours. And because it's so unpleasant, they tend to lose focus. So I would rather do shorter study sessions where you're actually focused like crazy rather than longer study sessions where you're distracted along the way. All right, so this is just a little pitch for the class. I've got some practice questions coming up. I've got 2 practice questions plus some strategies for practice questions. Just so you know, we're starting up on Monday our PT Live online review course. And just so you know, I did make some changes to the course recently. So I've been doing it for about 7 years, and I've been doing some fine-tuning lately. And I was able to reduce the price significantly. And the reason is that I'm able to create a hybrid between synchronous learning and asynchronous learning. This is what all the universities are going to these days, where you have time with the instructor to get your questions answered, to see and hear the material, but you also have videos and on-demand content that you can go through at your own pace, and therefore be able to take advantage of both. And honestly, that's where our culture is going more and more towards, it kind of that Netflix generation where we want the material when we want the material, and we'll attend and ingest that content when we can. And so by so doing, I was able to reduce the price. So we're less than half of any other PT course out there. We also have the most reviews that there are out there. Everyone else has the testimonials of their their mother and their best friend and their dog or whatever. We take actual reviews. These are actual like Amazon style reviews where people can submit the reviews. No one else does that. We're also the only one that has a money back guarantee, 14-day money back guarantee. Get in there, you hate it, I'll give you your money back. Go find something that fits a little bit better. So, and we have awesome pass rates. I'll tell you honestly, a lot of people don't look up a review course until they've had a failed attempt. And so what that means is that as a review course, PT Final Exam, we get a high, what do you want to say, about 50% of our class are people on a repeat attempt on their first, after they've had a first attempt, they're on a repeat attempt. Or we get a bunch of people who have difficulties with tests, with they have learning disabilities, they have, fill in the blank, any sort of impediment that makes it difficult to take standardized practice tests. And we still have an over 90% pass rate for people who really take it seriously and take the class. So with that being said, we're way above the industry norms as far as pass rates. We help people get through the test. I have all original content, an original practice exam, original study guide, an original workbook key, all of that to help aid. I mean, we've got over 80 hours of video. We've got a non-system section, integumentary. I mean, honestly, some people are charging like 5 times this amount for half the content. So very excited to be able to do this every quarter. We've got a great team, other physical therapists who are licensed, and we're all practicing therapists. I've been out on home health visits all morning. So we actually do this stuff. It's not just purely academic for us, and you'll see that in some of the other courses out there that it's just an academic exercise. We all actually do this for a living too. And so anyway, that's my little pitch. I hope you guys sign up. PT Final Exam, you can find all of our different pricing over at ptfinalexam.com. And also, when you finish the webinar here today, it'll also push you over to the PT Final Exam enrollment page. And I do highly encourage that you take a good look at that. All right, so let's talk about practice questions, guys. So I've got some tips when it comes to answering practice questions to do so in the most effective way possible. All right, so with practice questions, always, and this for me is number 1, always begin with a positive attitude. And what I mean by that is that when you go into the test with the idea that you are going to dominate and succeed, that is going to create this feedback loop where you walk in, you're feeling pretty good, your positivity results in improved performance. It helps you focus on the question better, to answer the question in the best possible light, which then leads to increased positive attitude. When you answer a question right, you say, I'm going to dominate this. This is great. So you have this feedback loop where you go from positive feelings to positive results and positive feelings again. The same can be true for negative feelings. If you walk in with a defeated attitude or anxiety, or you're feeling poorly about yourself, you walk in with that defeated attitude, it actually results in a negative effect on the test, meaning you perform more poorly, you answer the questions incorrectly, which then creates and propagates the negative attitude even more. So it's this self-fulfilling prophecy in a sense. When you walk in with a good attitude that you're going to dominate, it really helps you improve the performance. And the same can be said for the opposite. If you walk in with a self-defeated attitude, that can create a negative performance on the test. All right, so here's my method for reading the question. When you're looking at multiple choice questions, these are the keys to success. And these are certainly no secret, but this is how I do it. Like I just took the orthopedic certification specialty exam. And so I've been in prometric testing centers just within the last month. I've been studying like crazy, all that jazz. So here's my method for reading questions and answering questions correctly. You read the question. First, you read the question looking for the general idea. You just want to have some idea of what it's talking about, what it's asking. The second time you read it, you look for those key bits of information. It'll tell you, the age of the patient, or it'll tell you the duration of the symptoms, or the severity of the symptoms, or the mechanism of injury. They'll tell you that information in the question, and make mental note, and you can even highlight that in the prometric testing centers on the computer. You can actually highlight some of the text as well. And then the final read is just to look at that final stem of the question, and it asks which is the best, or which is the most, or least, or worst, or whatever. Make sure you're answering the right question. How many of you have ever had this happen where you answered a question, you answered the right answer, but to the wrong question? So make sure that you looked at the question thoroughly so you're answering it correctly. Then a lot of people say to formulate an answer in your mind, and this is what I like to do, to formulate an answer before looking at the options. So you read the question, you understand what it's asking, and you give a general, in your mind, you make a general answer to that question. Then you look at all the options, make sure you read all of the options before you make a selection. And so when you're looking at those options and as you're reading through it, make a mental checklist of all those items that are in the question. Those are the key bits of information, and then match those against the answer items. So remember, if an answer is partially incorrect, or if there's something in the answer that's incorrect, then that option is totally incorrect, meaning that it's not an option. I mean, it's an option, but it's an incorrect option. So for instance, if in the question they list 3 symptoms of a condition, look for the answer, or look for the condition that requires all 3 of those symptoms and not just 2 or 1 of those symptoms. Again, you're making a checklist of the items in the question and matching that against the answer options that are given to you. Remember, if it's partially incorrect, then that item is totally incorrect. Finally, if you just don't know the answer, so I get this question all the time. Okay, Will, I can narrow it down to a 50-50 yes. They say, okay, I can narrow it down to 2, but I can't decide between the 2. Unfortunately, that's how they write the test. They like to narrow you down to 2, where those are the 2 most plausible answers, and you have to actually know the content well in order to answer it. So make your best guess. Go with your first gut feeling, your first choice, and leave it alone unless there's some other compelling reason to change your answer. Because again, how many times have we marked down the correct answer and then changed it to an incorrect answer? You just don't want to do that. So there's no penalty for guessing. When it's 50-50, know that you have a 50-50 shot of getting it right. Mark down the first choice that comes to your mind, mark down the first one, and then just leave it alone unless you have some other compelling bit of information to help change your answer. But as a general rule, do not change your answer. And then the other thing, this is where, and I talk about this in the class, I've got some good examples as we go through the class, is about skipping steps. Sometimes it's so easy to skip steps where they'll talk about a condition and they'll say, someone comes in with a rotator cuff script. They're being evaluated for a rotator cuff. They had a major rotator cuff repair surgery. They're 2 days post-op. What would be the next thing you do? And on the list would be like Codman pendulum exercises, or completing a thorough examination with visual observation, range of motion. Obviously, what I'm saying is that you begin in this order, and this is actually the order. You do your detailed history and review of systems, followed by visual observation, range of motion testing, strength testing, followed by neuro testing. Now, they ingrained this to us in school that by the time you get all of these done, history, review, visual observation, range of motion, strength, and neurological testing, you should have a really pretty clear idea of what's actually going on with the patient. And then you confirm that by doing special testing, and then you create functional tests, either use standardized or create your own functional test in order to measure the progress of that patient. So we test, train, retest is the idea. And remember that your intervention should directly affect the function of that patient. So you do a test on the patient, your training should affect that test so that when you retest, it is improved. Test, train, retest. And then psychological testing is only if nothing else makes sense, then you can dive into the world of psych. Not the hit television show, but the psychological testing. All right, and then kind of the final thing is just know your content, and that's what we focus very heavily on in the course is understanding the content. We talk about key concepts, tricky bits of information, practice questions, things to really help you understand the content, because at the end of the day, you really do have to know the material in the question in order to have the best chance of answering it properly, answering it correctly. So I do suggest, and this is, I do this personally when I'm working on, as I was studying for the OCS exam, I take a practice test. Any of the options that I got wrong, I would create a flashcard about that question with the key information that I need to know in order to answer that question correctly. So I'm not memorizing questions. That doesn't do anyone any good, but I'm trying to understand the content in that question. And by creating a little flashcard, it gives me an opportunity to just briefly go through those on a regular basis. So that's why I love flashcards. I think flashcards are awesome, especially in light of the practice tests that you take. It takes some time. You have to review each practice item. You have to look up the content in those items that you missed. You have to create a little flashcard to help improve your knowledge in that content. But it's a great way to understand and learn the material for testing. All right, so with all of that, let's actually do a practice question. All right, so I'm going to open up. You're going to see the screen changing. Those of you on a mobile device will have to switch between screens a little bit here. But what I've done is I've created it's technically a poll, but I'm going to put up on the slide is a practice question. I want you to select your answer, click in your answer. Please don't type it in, but click in your answer. And I'm going to give you 72 seconds. I got my stopwatch out just for the occasion. All right, 72 seconds, ready, set, and go. I will be quiet while you answer this. 72 seconds, ready, set, and go. Right about 10 more seconds. 10 more seconds. And time. Okay, so that was 72 seconds. And again, remember that's the average time you need to spend on the test. And the answers are totally anonymous. I don't get to see who clicked what. I just get to see a breakdown or percentage of who clicked, or of what was clicked, not who clicked. So a patient has suffered a traumatic blow to the posterior knee, begins to exhibit signs of tibial nerve dysfunction. Which of the following impairments will most likely be present with a tibial nerve injury at the level of the popliteal fossa? So remember, popliteal fossa right behind the knee. So the question is, what happens to the tibial nerve below that lesion? You would be correct if you put down number 4. Trauma to the tibial nerve would weaken plantar flexion and alter the sensation of the plantar surface of the heel, getting that tibial nerve. Because just above the popliteal fossa is where the common peroneal nerve comes off of the sciatic nerve. So therefore, where it's at the level of the popliteal fossa, the common peroneal nerve would not be affected. So therefore, you'd have obviously the difficulty with plantar flexion or the plantar flexors versus the weak dorsiflexion. And so you can see I phrased this question with these pairs, and you can see that the pairs got ankle dorsiflexion, plantar flexion, plantar flexion. and then the loss of sensation on dorsal, plantar, plantar. So you can see they love writing questions like this where it's each of the items has something that is wrong in it except for the most correct item by testing you on two topics, the motor function and the sensory function of the tibial nerve, all wrapped up into the same question. So they love questions like this, just love it. So remember, if the injury was above the level of the knee to the tibial nerve, then you would also have difficulty with the dorsiflexors as well, getting that deep peroneal nerve. However, because it's at the level of the popliteal fossa, the trouble is with plantar flexion. All right, do you have it in you for another practice question? You guys, we've been talking for almost an hour here. Practice questions are always so good, right? All right, we're going to open up another practice question here. All righty, so manipulating the screen again. I will give you 72 seconds again. I will be quiet while you answer. Ready, set, and go. All right, just a few more moments. And time. Okay. So this one, obviously, we're talking about the roll and glide rules with regards to convex concave joint mobilizations. A patient is noted to have limited great toe extension during the terminal stance phase of gaits. Remember, you require a significant amount of great toe extension during that terminal stance phase of gait. In order to increase the first MTP joint extension, which joint mobilization would be most appropriate? Well, the correct answer is that dorsal glide, and that's related to the anatomy of that first MTP joint. So remember, with the convex concave rule, convex concave, see if I can get my pen to work, concave. The roll and glide occur in the opposite direction for a convex joint, and they occur in the same direction for a concave joint. So the way I remember this, that concave and same both have an A in them. So typically the most distal segment is the mobile segment, and that's where you'd make the determination of whether it's convex or concave. So here in the first MTP joint of the great toe or your big toe, the distal segment has a concave portion, and then the first metatarsal, it has a convexity at the end. So therefore, we apply the concave rule, meaning that roll and glide occur in the same direction in order to roll into an extension, to get that great toe to extend. As you bring that great toe into extension, in order to get it to extend, you have to glide that proximal phalanx dorsally, or the way it's pictured in the screen, it'd be coming out towards you, or towards the dorsal surface of the foot. So a dorsal glide would follow the concave rule and be the one that would improve and be most effective at improving great toe extension. Then these other options are obviously, you've got the plantar glide, or going in towards the plantar surface, the dorsal glide, the dorsal surface, medial and lateral glide. Is that the same function as the first thumb MCP joint? I'm so glad you asked that question, because the MCP joint in the thumb is a saddle joint, And I talk about that in the class. I've got an image in one of the lectures where we talk about that, and it's a lot easier to see with the image. But essentially, a saddle joint has some aspects that are convex and some aspects that are concave. And so that'll be just a little preview. If you go to if you just do a Google search of the saddle joint of the thumb, you'll see that flexion extension has, I believe it's a convex or concavity, and then adduction is a convexity. I pull up the picture just so you guys could see that. It's a lot easier to see with the picture. So I do highly recommend that. And as a note, I do talk about that in the course as well. The saddle joint of the thumb. Cool. So there you go. There's some practice questions. We've been going for about an hour now. So tell me, guys, what questions do you have? I want to make sure that there are no unanswered questions here. What questions do you have related to the exam, related to preparation for the exam? What do you have for me? Great practice question. Good. I've got lots more. When you dive into class, you'll see tons and tons more. Love practice questions. We also talk about the content too. I love spending time on case studies. Like I've got a whole section that I talk about autonomic dysreflexia, spinal cord injuries, all that. Alexis, who has the best practice exam? Oh, that is a great question. So the best practice exam is the PEAT, Practice Examination and Assessment Tool, that's put out by the FSPPT. It's an actual retired, it is an actual test. They designated one of them as a practice exam, and so therefore you can gain access to that. Go over to the FSPPT website, and it's available for purchase. So that is the best one. See, Katie, do students who complete the independent study bundle have similar success to individuals who take the live class? So Katie, great question, referring to the independent study course versus the live course. So I have two options. I've got live option where you get access to instructors, you get access to live lectures, versus the independent course, which is all totally pre-recorded. So I don't have as much data on that independent course, obviously, because everyone's doing it very independently. It is the same content, so in theory, a person who applies themselves with the same degree of studyability, when they apply themselves to an equal degree in each course, you would have similar results. I have found that the psychological component, now tell me if I'm wrong here, as physical therapists, I would dare say that many of our patients know what they should do. At least as a general rule, they know they should do their home exercise program. But the people who actually do it are the ones who show up to therapy and be like, okay, yeah, I actually did. There's some accountability to it. So Katie, that would be the only edge that the live class has. And obviously, access to great instructors like us if you do have questions. But the accountability has a massive improvement on scores just because it makes you actually do it rather than just think you'll do it or plan on doing it or consider doing it. You actually do it. So there you go. That's the best answer I have for that. Let's see. Thanks so much. Practice questions were awesome. Yeah, I've got tons more. I buy the PEAT for the past October test. You'd recommend me buy it again for the July exam. So Yarmar, that's a great question. Should you repurchase the PEAT? As a general rule, I tell people to not repurchase the PEAT. I mean, obviously it's money, so I want to save you as much money as possible. And the reason is that the PEAT is great for assessment. It's also great for review, but you have lots of other options for review likely that are already available to you. So rather than spend another $90 on another look at the PEAT, I would suggest save that $90, maybe buy another 3 exams from Therapy Ed or whatever, and spend time with the resources you have rather than repurchase it. If you're planning on purchasing the PEAT, then I do recommend saving at least one of them for about 3 to 4 weeks before test day as a good indicator of, because I like having you start with a practice exam and end with one of the PEATs. That's the best way to study because you get a good indicator of where you're starting from, and then you get a really good estimation of your performance, but you still have some time to improve between that last PEAT and test day. What I don't want you to do is to take a practice exam 2 days before test day, because that might be helpful a little bit for the content, but it's not as good as giving yourself some time to really learn the content on that practice exam. See, Rachel, when I take your course, do you provide any book? Yes, so it's all electronic. So you get instant download, and you're able to do PDF search, and you can see all of the material and look for any content that you'd like to. And so that's a nice part about electronic textbooks, is you can really quickly search through it. But yes, I provide it's about 1,000 pages of content between the study guide, the workbook key, and the practice exam. It's a bunch of pages of material in PDF format, obviously. See, Eliane, my question is, in reality, concern anyone else worries or who will be impacted by the coming chances in eligibility by the FSBPT. So I know that there are some changes going on with regards to credentialing. I know there are some changes that are coming up there. They're still trying to get those all in play. As far as, like, one of the guys who works with me is licensed physical therapist. He's from the United Kingdom, and he's got his finger on the pulse of what it takes to, as a foreign applicant, to apply for the NPTE and take it here in the U.S. And they're increasing the standard, the educational standard required in order to be eligible to sit for the test. So usually what that means is, for foreign trained applicants to the NPTE, they have to take more classes and coursework in the U.S. in order to get equivalent, what they call equivalent education, and be eligible to sit for the test. But it's a real concern. Let's see, Yaramar. Okay, do you have a few exams so I can purchase? So I've got one available, and it comes as a package deal with the study guide and workbook. And you can find that's all for $49 over. If you go to ptfinalexam.com/resources, you'll find all of that if you want to just get the practice exam. How many sample questions we get in the program? So I've got 200, about to roll out another 200 soon. So at this moment, 200 is what you get as a part of the course. Cool. What other questions do you guys have? I know that the NPT is a very stressful time. There's a lot going on. Again, a lot of you are targeting that July test date. Remember, check out fsbpt.org for all the dates, because you have to have all of your, to apply and take the NPT, you have to apply for licensure in your state. So you have to identify the state where you want to practice, apply for licensure in that state, and then it's the state that determines your eligibility for the NPTE. Wakar, where can foreign trained physios cover up their course deficiencies? Great question. So as far as getting your course, so for instance, if you need more credits or academic credit hours in order to be eligible for the test, the best place is your local university. Find someplace close if you can. I'm not sure I have any great recommendation there other than just make a few phone calls to places near you. That'll be your best bet. Kasui, is your program self-study based? So Kasui, great question. I have two options. I've got a live course where you get access to instructors. We do live lectures like this. We have a ton of fun. Lots of accountabilities we go through. You get access to a private Facebook group, opportunity to reach out to study partners, very interactive. But I also have what I call the independent study course, which is totally independent and is a self-study program. It's less expensive, but you don't get access to the live lectures or the instructors. So, and I guess in a broad sense, we can't come into the exam with you, so it does depend on your study, your self-study. But we do try to direct you. In the live class, we direct you as much as possible. Let's see, Kate, how early before test day would you recommend beginning to study for the NPT? I love somewhere around the 8 to 10 weeks before test day is a real sweet spot for me, just because it gives you plenty of time to study, but it's not overwhelming. But I will tell you, if there's someone who's been, like for instance, I had a 65-year-old woman who was reinstating her license. This was 2 years ago now. And she did she'd been out of practice for longer, since before I was born. She'd taken PT school before I was born, and she had practiced for a while, let her license lapse. She had to retake the NPT in order to reinstate her license. She did a 6-month study plan. So it does depend on your current level of knowledge of the material. If you have a good, solid grasp of the content now, then 8 weeks is more than sufficient. If you need more remediation, like it's been a longer time since school, you struggle with coursework, then you may need to look at doing more than 3 months. But usually 8 to 10 weeks is really pretty solid. Pretty good recommendation. Alexis, how does your practice exam content compare difficulty to the other practice exams, scoreability, solvent, etc.? So my practice exam tends to correlate nicely with therapy ed. or the O'Sullivan practice test, which is slightly harder than the actual NPTE. So what that means is that the score people get on my practice test tends to be just a little bit lower than what they actually perform on the NPTE. Now, that being said, there's a caveat there. They take my practice test before the real exam, so the theory would be they learned something from the attempt on my test until the attempt on the NPTE. But as a general rule, my scores tend to correlate nicely with the O'Sullivans, which are slightly harder than the NPTE, which I feel like is a good position for a practice test getting ready for a giant exam like this. See, Christy, to study for musculoskeletal, should I think terms of injury and names of test? Ooh, great question. So, Christy, when I think about the musculoskeletal system, I love to think about it in terms of diagnosis. We're talking about not just illnesses, but also injuries. And so, for instance, ACL, they love testing on ACLs and meniscus injuries just because they're so common. ACLs, meniscus injuries, total knee replacements, total hip replacements, all those very common diagnoses. So with that in mind, you have that be the broad category you're studying today, and then you look at all of the examination techniques required in order to effectively treat that individual. You need to understand, what you would do for, the Lockman's test, the anterior drawer test, the posterior drawer test, the medial and lateral collateral ligament stress test, varus valgus stress test. So you look at the diagnosis, you look at all the examination required for that diagnosis, and then move on to differential diagnosis and intervention. And I try to do that in the course to create it in that framework where you look at the diagnoses, then you do differential diagnosis between them, and then intervention based on what you found in the exam. So, Christy, I hope that answered your question. To study for musculoskeletal, should I think in terms of injury and names of tests? Yeah, you have to know the names of the special tests for sure. There are a bazillion special tests, so focus on the big ones, like understanding what Lockman's test is, understanding what McMurray's, Napoli's test, and Thompson versus Thomas test, all those. So yeah, absolutely, you have to know those. So Rachel, should I first study on my own before taking your course? Not necessary. So my course, I try to start from the beginning and do a really broad review of about everything as much as we can. Obviously, it's three years of schooling. We're trying to cram into 8 weeks, so it is a review. But so it really would depend. So Rachel, it really would depend on your current knowledge of the material. If you're very weak on many subjects, then perhaps shoring those up before you jump in. But the good news is I also have a till you pass access option, meaning you basically one-time ticket price, and you get to take my course as many times as you want. You have access to us as long as you want. You get it all for as long as you want. So yeah, that would be my answer, is that probably just getting that till you pass access would be the best. Samir, what do you think about basic osteology and histology? Do we need to go through that, as I don't see it in review books like Therapy Ed? Yeah, I wouldn't spend a lot of time on histology. Obviously, you need to understand the difference between a muscle fiber, actin, myosin chains, muscle fiber, versus a tendon or ligament with the collagen fibers. And then the basic levels of skin, so the epidermis, the dermis, and all the subdermis or subcutaneous tissue. But I wouldn't spend a ton of time on histology itself, just general ideas of what the difference between skin and bone and muscle is. See, Kasui, I took NPTE this April and failed. I scored 507. What is the least amount of time needed to pass the NPTE? Ooh, great question. So to bump up a score from a 507, so in my class, I've had bunches and bunches of people who have improved their score by, the average is about 50, but I've had bunches of people who score about over 100 points in a 3-month period. So, Kasui, it really depends on how much time you have available. Like if you're dedicated to the cause and July's coming up, no holds barred, you're going to dive in and take it in July, then that's sufficient time. But that could be different if, for instance, your work schedule, let's say you had a full-time work responsibility, full-time family responsibilities, you had 2 trips planned that require your time away from your study for a bit. So it really depends. I mean, so it is totally possible to bump up your score 100 points in 2 or 3 months. Absolutely possible. I had one person who did, I think they did 147 point increase in 8 weeks. I mean, totally possible, but it does depend on your available time. So there you go. That's the idea. And so just as a note, as I said before, people who take my class typically have about a 50-point increase on their scale score. That's the average. So obviously some a little bit less, some a little bit more. And my record holders are well over 100-point increase after 8 weeks. Plus, did I tell you, I mean, I don't want to talk your ear off talking about my course. We're starting next Monday. I just want to make sure anyone who's really interested in jumping in is with us for Monday because, like I said, it's the only course out there that takes actual reviews, not just testimonials from their mother. And we're about the only ones that have a satisfaction guarantee, meaning you can take it, test it out. If you hate it, I'll give you your money back. Lots of options there. Marasan, does your review class focus on the Canadian exam too? Like we have vignette type questions. So I'm good friends with one of the gals who runs it's not an NPTE, it's the PCE, the Physiotherapy Competency Exam in Canada. So she and I are friendly. We talk about preparing for the exam. It's the same content, just in different format. So Canadian exam obviously is vignette style questions, plus they have a practical component you have to pass. So thank goodness for those of you here in the US, you don't have to go to a testing center and do a practical exam. But for the Canadian exam, it is vignette style questions. So everyone who's taking the NPT in the US, plug your ears right now. In Canada, it's vignette style questions. You have one little vignette, and you answer multiple questions off of that. But it is the same content, the same textbooks, just slightly different format. All right, everyone who's taking NPT can unplug their ears now. Of course, if your ears are plugged, you couldn't hear me tell you to unplug your ears, so to unplug your ears. Yes, we're starting up next Monday. Scads of content. Like I said, I've got modules on the non-systems and integumentary lymphatic. We're always building out content, working on more and more practice questions. And you have access to us. So if you do have questions along the way, if you have a freak out moment, that's what we're here for, is to help you answer questions and help you stay on track so you'll be ready for test day when it comes in July. And I know there's a bunch of you maybe targeting the April, but the October or January exams. And just so you know, we have those till you pass options, which gives you access to the content for as long as you need in order to get through the test, which is honestly life has some unexpected moments. Maybe you have to postpone your test, and it's generally a good idea to grab that till you pass access. Cool. Other questions out there? Any other questions that you have before we go? I want to make sure we answer as many questions as we can, if there are any more. You guys have been great. Love the questions so far. Any other questions before we tune out? Tune out? Sign off for the evening? Okay, well, thank you guys so much for participating tonight. I really appreciate it. I hope you learned something about the NPT. Hope you were able to make an actionable game plan for how you're going to attack the NPT and to just really crush your attempt. I know that positive attitude and a positive mindset makes a world of difference on this test. And so the better you prepare, the more positive energy you have and positive affirmations about your preparation, the better your performance will be. Now remember, nothing can compensate for not knowing the material. You have to know the material. But when you learn and when you study it, recognize when you do something right. Because when you do something right, that makes a world of difference. When you recognize and give yourself a positive affirmation. So thank you so much. I do wish you all the very best on the test. Those of you who are in my course, we're starting up on Monday. Please jump in. We're going to have tons of fun. Got lots of practice questions and case studies. I think you're going to love what you find over there. So, Kasui, what is the main difference between your program and others? So, twice the content, half the price. I actually, this is funny, and I actually taught some of the other programs out there. I was the one who actually helped them get through the test. So, really, they're trying to mimic all the great stuff we have over here at PT Final Exam. And don't get me wrong, I've met all of them. I think I've met each one personally and talked with them personally. Almost all of them. Like I've talked with the CEOs over at Score Builders and Therapy. I'd talked with all those folks. I didn't train them. They've been there. They've been around for a long time, and they really just focus on the textbooks more than anything, or the review books. Anyway, bottom line is this is the source. twice the content, half the price. Some of the other places don't even have practice tests or review books or workbooks or anything like that. They just get up there and they talk, which is fine, and they're really nice, and I think they do a decent job. It's just this is the original, and this is the only one that takes real reviews. Everyone else just has testimonials up. Let's see, Betsy, if I have further questions, do you have an email address you prefer me to use? Yeah, so you can always just, any of the emails that you just got from me to find this webinar, you can just hit reply to any of those. Or you can go to admin@ptfinalexam.com, also a good place to reach out. Or you can hit contact over at ptfinalexam.com/contact, and you'll be able to send email directly to me. Would you recommend any book? Oh, I love the textbooks. I think my favorite, I've got a couple of real favorites. So Physical Rehabilitation by O'Sullivan is probably the highest on the list. Second highest on the list would be, I'll get it out without knocking everything over. Second highest on the list would be Differential Diagnosis by Goodman. Also a fantastic one. And then obviously McGee or Dutton and Kisner. Those are all fantastic. And I have a list of all those if you go over to ptfinalexam.com/resources, and you can find all of the listed textbooks there, links to all of them. See, Katie, I've heard there are themes to each exam. Ooh, this sounds like a good question. I've heard there are themes to each exam. Do you tend to cover those in the live course you said before you teach? The live course essentially is the same as pre-recorded on the independent course. Also, do you typically update the independent course regularly to reflect the live course changes for each exam cycle? So, Katie, the first thing you said, there's a theme to each exam, is a myth. That's not true. There's no theme to each exam. Each exam is a randomized conglomeration of those topics in the proportion that we talked about. So, for instance, there are about 60 questions on musculoskeletal. So, I guess that's a recurring theme, so to speak. But no, there's not any particular theme. It's randomized, and it covers the broad spectrum of the PT practice. As far as the independent study course, it does get updated about every quarter. So I do my live classes, I do updates, and I try to address any questions that are current. And then the independent course is obviously recordings. And so as soon as I finish the recordings of a cycle, I plug those into my independent course. And so it does have kind of a 3-month lag period, but it's almost, the information is almost identical. It's just the presentation and the accountability that come with the live class and the access to us as instructors to get your questions answered. Let's see, Nina, do you also give us NPTE format exam like as if we were taking the real exam? Yes, so I do have a practice exam that is included as a part of the course, both the independent and live course. Let's see, Rachel, thank you for tonight. Is there a need to buy more than one book? So the big ones I talked about, O'Sullivan, Kisner and Colby, McGee, and Goodman are probably the top 4 on my list. And again, if you go over to ptfinalexam.com/resources, see if I can spell it right, /resources, ptfinalexam.com/resources, that'll give you a good idea of some of the other textbooks that are most commonly used. See, Alexis, is your exam electronic or PDF? So right now it's in PDF. I've got an electronic version as well, so you can take it in an electronic type version where you click through and you get your results emailed to you. Katie, always happy to bust myths. I love busting myths. It's so fun. I mean, you'd be amazed at how many myths there are about the exam. And this is a big myth. I didn't list it here, but I did mention earlier. Some people really think that the NPTE is a computerized adaptive test, or a CAT type test, where the questions change based on your response. So for instance, if you got a question wrong, it would ask you easier questions, or if you answered a question correctly, it would ask harder questions. That is not at all the case. That is a total myth. It's just a block of questions. You answer that block of questions. The idea is to spend 1 hour per section. There are 5 sections on the test. 5 sections. I've had guys who have taken the test and they've miscounted the number of sections. Remember, on the PT exam, there are 5 sections. You get a break after section 2, and you've got 3 more sections after that. So, yeah, no themes on the test. But I mean, again, common recurring themes like this, where you have cardio, musculo, neuro more heavily represented. Is it possible they ask you 2 or 3 questions about a similar diagnosis? Absolutely. I mean, there's only so many diagnoses to choose from, and they love ACLs and meniscus and total knees, total hips, all those very common musculoskeletal conditions. So you can plan on a couple of questions about those. Cool. Any other questions before we sign off? I really appreciate all your great questions, guys. This has been fantastic. Be sure to head over and join. We've got a free Facebook group called NPTE Resources. If you go over to the PT Final Exam Facebook page, you can find an easy link to the NPTE Resources. I try to post a question a day as often as I can, or as many, I try to post practice questions there for your discussion. I think you guys will like that. Who doesn't like practice questions? And they're original. You can be sure that we're not pirating stuff from other people. I mean, this is the real deal. And honestly, I've had some of the other folks who shall not be named a lot of times like to take my questions and post them, and what can you do? So back to the source. PT Final Exam, getting awesome. Kasui, is it true the exams are getting harder each year? Not each year, but every 5 years they are. So in 2018, they did increase the standard. So the exam is harder now than it was 2 years ago, but by only about 4 questions every 5 years. So essentially, with each passing year, you have to answer 1 more question correct in order to pass the exam. Cool. Any other questions? I love these questions, you guys. I just want to make sure we get them all answered. And like I said, you can always head over to the NPTE Resources Facebook page, and you'll be able to find, or you can access me and put any questions and join in the group. And that's all totally free if you want. I also have a free course. If you go to the main page of PT Final Exam, you can sign up for a free course about how to pass the NPT. And it's just a general idea of what we talked about tonight, where it puts in a little more structure and detail to your studies. Ooh, can I see the slide on the exam content? Yes, in fact, I recommend that you check out. In fact, let me pull it up here. So everyone needs to spend time over at .org content outline 2018. I'm going to post the link for you. Everyone needs to take some time looking at this content outline. Totally free. You get on there and you can see, let's see, how many pages is it? It is a bunch of pages. 12 pages? Bunch of pages talking about, 12 pages based on, or what the exam is actually testing about. Susan, for a repeat offender, how do you change your pattern of studying? Okay, so for anyone who's taking the exam for a repeat attempt, the best advice I have for you is to, while you can, make a list of the topics that you wish you had known better on exam day. So for instance, if they asked some questions about the ACL, about Lachman's test or whatever, put that on your list that you need to spend more time learning about Lachman's test. And then that should be your prioritized study approach to hit those topics so that you have increased your knowledge based on the weaknesses that you discovered during the actual attempt. And then the other big thing is I highly recommend the note card method. Whereas you go through the practice tests you've already taken, spend some time creating little flashcards about the questions you got wrong, and spend some real time trying to understand that concept so you never get it wrong again. You know it so well, and what is it? There's a cliche phrase, know it so well that you don't just get it right, but that you never get it wrong. So that would be my advice to anyone who's a repeat offender. A repeat offender is it's a funny phrase, talking about having to take the exam again. I think it has obviously some negative connotations. So I say maybe not successful yet, maybe just working on, fine-tuning your skills, getting through the exam. Totally possible. See, Susan, is the PEAT truly a determinant of passing the NPT? Because I passed the PEAT with high scores, but still failed the NPT. So Susan, it does have the highest correlative values. So if you were a statistician, and you looked at the PEAT, you would see that the percentages are almost identical. That being said, Susan, I have seen people who have passed the PEAT fail the NPT, but I've also seen the other way around where they failed the PEAT and passed the NPT. So sometimes it does depend on the environment of because the PEAT is inherently a low stakes exam, whereas the NPT is a high stakes exam. So that dichotomy between low stakes and high stakes means that performance can be varied, especially if someone has anxiety, especially if they took the PEAT in a more relaxed environment versus a more high stakes style environment. So there are some inherent differences, but assuming that all things were equal, it does have the best correlative value, which means that it's correlated. And we all remember this, correlation does not equal causation. So I still stand by that the PEATs are the most have the most statistical evidence for that, but obviously not a perfect tool. Cool. Other questions? Let's see. Kasui, I took the PEAT last April. How often does the PEAT renew? If I take the PEAT again, will I get the same PEAT? If you took it last April, it will be the same PEAT. I believe they'll be changing it at the end of 2020, so at the end of next year sometime. They don't announce when they're going to do that. That's not public information. You can call them and see if they give you much of an answer, but usually they say, well, maybe sometime next year we'll change the PEAT. But for now, it is the same PEAT, same one that you purchased. If you purchased one last year or last month, it's the same one until next year, maybe the end of the year sometime. Let's see, Kasui, I really hate any questions related to medications, drugs, etc. I don't see many questions related to medications on the NPTE. Is it still worth studying medications? Medications, you just need to understand the classic ones. So for instance, beta blockers, calcium channel inhibitors, ACE inhibitors, some of the major pain meds like naproxen, aspirin, Tylenol, ibuprofen, maybe into a little bit of the levodopa like Parkinsonism, baclofen, muscle relaxant type ones, but don't spend a ton of time, but just look at it in terms of what is the most common. So practically every cardiac patient you'll ever treat will come in on a beta blocker, calcium channel blocker, and an ACE inhibitor. So it's going to come with all three of those typically. So therefore, study with that in mind, that when you're studying those types of concepts, understand that they will likely come in on those major types of medications. And if you do that, then that's sufficient for medications. Cool. Well, guys, we've been going for about an hour and a half. I thank you so much for your participation. Again, feel free to reach out. You can check us out on Facebook, find us on Instagram. Be sure to jump into our free groups over there. We've got a free course up on PT Final Exam. We're starting up our big live class next week, so be sure to be there. And then bottom line is good luck with everything. Happy studying all the way across. Will Crane fist bumps out all the way around. And thank you again so much for your time. And I look forward to seeing you in the class. So thanks, guys. Appreciate it.